Hello, I'm Heather Knox, and this week I'm going to talk, as I usually do, about where we're at in terms of the pressures on our system as a result of COVID and the recovery from the pandemic. I will talk about the action we had to take last week with really overwhelming staff pressures and service pressures, and we had to really escalate those concerns nationally and locally and open up an awful lot of additional resource to deal with the demand that we were seeing across the whole of our service, so primary care, community services, but really most notably in our ED departments and our acute hospitals. So it was a very difficult week last week. I'll start with the numbers. So currently we have 91 inpatients across the 3 hospitals, and that's really stayed between 90 and 100 for the last maybe 10, 14 days. But it is down from a September peak of around 138. So it is trending down, but it's plateaued a bit over the last couple of weeks. So we're hoping that that will go down further. Within ITU, we've got 5 patients and 7 patients on CPAP, and we've got 2 outbreaks in care homes today. 401 new cases reported yesterday, but we are seeing less proportionally of those patients being admitted to hospital, which is what is protecting us really. So the vaccination is absolutely working, and important that you encourage particularly young people to get the vaccination at this time. And also we're doing really well with the booster uptake, so around 86,500 people have now been given the booster. And again, encourage staff and colleagues just to make sure that you promote that message as well, because it's one of the things that will absolutely keep us safe as we go into the winter. Following on from the extreme pressures last week, I know there was quite a lot of correspondence with staff and media around those pressures. Personally, I was away last week on holiday, so really grateful to my colleagues for taking that forward for me in my absence. And just to reinforce, it's important for everybody to get their holidays. That includes me, but absolutely everybody. You should be taking your leave. It's difficult at the moment, so make sure you do get your breaks. In response to those pressures last week, we were in a very difficult situation. It's not quite as bad this week, but it's still a very stressed situation in terms of those pressures. I brought together a group of people yesterday as part of our Go Command structure, and we've probably identified 5 areas that we'll take forward over the next 6 weeks in terms of short life working groups to see if we can make a difference to the number of patients being admitted. The first of those areas is to really look in more detail at what we can do in terms of anticipatory care planning within our care home settings, so we'll do a piece of work around that. We're going to do a really fast track piece of work around respiratory pathways, again see if we can stop people being admitted and care for them in their own homes if at all possible. Thirdly, we're going to try and augment hospital at home. That will obviously be done right the way across the system in partnership with health and social care partnerships. We're going to see if we can improve GP access to diagnostics, particularly radiology, and see if that makes a difference in terms of patients presenting at ED. And we want to do further work on frailty and really understand the needs of the patients that are within our hospitals and see if those can be cared for in alternative settings. So those 5 pieces of work, I will be allocating leads to all of those later on today at our Go Command, and we'll be looking for early report back from those groups to see if we can push things forward in advance of winter, because we really do need to build up a bit of capacity in advance of the winter pressures. So that's what we're doing in response to the escalation last week. I want to talk a bit now about Black History Month. I mentioned this a couple of weeks ago in my broadcast to you, and I said I would come back to it and talk about it again. Black History Month is about celebrating achievements of Black people, but it's also about really continued action to confront racism. And I've talked a bit before about racism, and as an employer we have a zero tolerance approach to racism, and I hope people would feel able to raise any concerns that they have in the workplace. And you can absolutely do that through HR, and also the unions have a role obviously to play in that as well. So we would work in partnership always to tackle any issues of racism. I think I did mention previously when we saw the correspondence and the media interest around George Floyd in May 2020. At the time I was part of a national learning network. In fact, it was an international learning network. And I was privileged to hear the personal account of a lawyer in New York at the time. She was in her office looking down in the wake of the George Floyd incident, and there was rioting in the streets in New York. And she talked to us about the messages she was receiving from friends and colleagues, and those messages were saying, this must be so hard for you, this must be so difficult for you, we feel for you. And her point to us on the call was, this should be hard for everybody. This is about humanity, it's not about a black person or a white person, it's about humanity. And that to me was the shift that we need to make in our own minds. And I think I have at times been guilty, unconsciously, of having bias, and I think we all need to tackle that within us. And that was the message I wanted to put forward to you today, to maybe see if you can think differently, think inclusively, and if that's one thing you take in this month of Black History Month, that's a good thing. Thank you.